name is Aisha. I'm one of the nurses at the Genetics and IVF Institute. Welcome to Ivf Class. The goal of Ivf Class is to help you become acquainted with the process you're about to embark upon. We're going to go through the details of what IVF entails, the objectives, what we're trying to accomplish, and review your cycle planner. IVF is also known as in vitro fertilization. Really, all IVF is an exaggerated menstrual cycle. Normally, your body produces one follicle that ovulates every month. In IVF, we need multiple follicles to develop. We really need to get eggs of the same size or maturity at the same time. Think of it as having school-age children in a cohort together. We don't want a first grader with a third grader. We need them to grow together at the same developmental rate. IVF does this with a combination of medications. We need the body to recruit as many eggs as possible because we need to maximize the chance of overall success. By having many eggs, the physician has more attempts to become successful with this one treatment phase. It's really important that you do not ovulate in an IVF cycle. One of the medications we need to give you is to suppress your body's natural reaction to ovulate. The reason being is we need to be in control. We need to make sure that the eggs that we are growing don't release prematurely. A premature ovulation will result in the cancellation of an IVF cycle. So think of this a little bit like a tug of war. What we're trying to do is give you medication called gonadotropins to grow many follicles, and other medication called suppressants to ensure that you don't ovulate. This tug of war is a pretty delicate balance, and the physician's job is to make sure that he has this cocktail of medications exactly right. Because of this, you'll need to be seen very frequently for blood work and ultrasound throughout a 2-week period leading up to the egg retrieval. As I stated before, there are several appointments that you'll need to be seen for during an IVF cycle. We call this monitoring. Monitoring appointments happen in the early morning, and they're very important for the overall success. You will need to have between 6 to 8 monitoring visits leading up to the egg retrieval itself. These appointments will include blood work and ultrasound. The blood work is looking for estradiol levels. Estradiol is a hormone that your body emits when it's going through the follicular phase, or the growth of the follicles. We want to measure this growth because it gives the doctor clues as to how your body's doing with the amount of medication. We want to have sonograms because we can visually see how the ovaries are reacting to the same medication. Together, the ultrasound and the blood work give the doctor a complete picture of how you're doing in the IVF cycle so far. When we do sonograms, you'll actually be able to see what the physician is seeing, and I think that's a pretty cool aspect at Genetics and IVF Institute. You might, however, wonder what you're looking at. A sonogram is a black and white photo, and when we're looking at an ovary, it looks a little bit like a cluster of grapes. When you first start an IVF cycle, before you take your medications, at the baseline appointment, that ovary will look like grapes that are pretty darn small. When you start taking medications, those quote-unquote grapes grow in size. You'll actually be able to see that growth. That growth is measured by the physicians, and that tells the physicians that the medication that you're taking is doing its job. This ovary shows that it's been on medication for about 10 nights. Notice how the follicle size is quite large. This ovary is soon to be retrieved. There are a lot of medications that you'll need to take in an IVF cycle, and it can be really overwhelming. Be assured that it's our job to help you through each and every one of those. You'll be ordering your medications through an online pharmacy, and it will be delivered to your door via FedEx. My recommendation is that you open this package and take out each medication and review that with a packing slip to make sure that you've received everything you were supposed to. Some of the medication might need to be refrigerated. It's important that you read what needs to be refrigerated and put it in the refrigerator as soon as possible. Other medications can be kept at room temperature, and you can find a place to store them that's easy for you to remember. We know that the medications can be an overwhelming process, and it might be a little bit scary for you. The nurses at GIVF are here to make sure that you understand what each medication does and to make it a little less scary. The medications you'll likely be on will include birth control pills, gonadotropins such as Gonal-f or Follistim. Those help to grow the ovaries. Suppressant medications, either Lupron or Antagon. Those help to ensure you don't ovulate. Prenatal vitamin, that's just good practice no matter what when you're trying to get pregnant. An antibiotic towards the end of the follicular phase to ensure that you don't get an infection. And progesterone to help the endometrium vascularize. Think of it as preparing a nice fluffy bed for the embryo to land into. Let's review a little bit about what to expect from start to finish. The very first medication your nurse will ask you to take is a birth control pill. A lot of patients find it really odd that they need to take birth control pills in order to help them become pregnant. But birth control pills play a really important part. They tell your ovaries to be pretty quiet the month before we actually do the IVF cycle. As such, you will be taking one pill daily by mouth for about 2 to 3 weeks, with the goal of keeping your ovaries nice and quiet during that time. You will be advised by your nurse to stop the birth control pills approximately 3 or 4 days before your first appointment. You might get your period before your first appointment, and that's okay. This first appointment is known as the baseline appointment, and the baseline appointment will allow us to make sure that your body is nice and quiet and that the birth control pills did its job. Basically ensures that we're ready to start the next phase of the IVF process. At the baseline appointment, you will have blood work and ultrasound. You'll meet with the nurse to discuss taking the medications later that evening, and you'll be able to go back to your normal activities. The doctor will review your results and instruct the nurse to contact you with your instructions. Please let the nurse know which way you prefer to be contacted, email or phone call, as that's important. The very first night that you start medications might be a little angst-producing. Please know that we are here. You'll be given instructions to start the gonadotropin and maybe even the Menopur. By that time, you'll already know how to give yourself these injections, and you'll realize there's really not much to it. You'll dial up the dose that the doctor has prescribed, and you'll do that for the next few days, making sure that you do it around the same time every day. During that part of the process, you'll also need to continue taking your prenatal vitamin. Your next appointment will be scheduled in advance, so you'll know ahead of time when you need to come back to the Genetics and IVF Institute. But you'll want to come back frequently, as scheduled, so that we can perform the necessary monitoring. Remember, the monitoring is really important. We have to measure the follicular growth and ensure the estradiol level is where we need it to be. We might make changes to the medication, and that's okay. These changes just help the doctor pinpoint exactly how much you'll need to be successful. During the monitoring phase, you'll be seen every 2 to 3 days in the beginning, but as your follicles grow larger and larger, we're going to need to see you almost daily. That's because we're close to the egg retrieval itself. When we finally see that the eggs have reached maturity, we will ask you to take the trigger shot. Now, the trigger shot is the only injection where we ask you to take it at a very specific time. This is because the trigger shot will force you to ovulate 36 to 42 hours later. The suppression medications have been telling your body not to ovulate for so long that we now have to force it when it's time, on our watch. You'll take this trigger shot at the exact same time that we say, and you'll come in approximately 2 days later for the egg retrieval. For example, if we tell you to take the trigger shot on Monday night, you'll then be given a time to arrive for the retrieval on Wednesday morning. The final medication in an IVF cycle is progesterone. Progesterone can come in multiple forms, most commonly intramuscular injection. We'll teach you how to take your brand of progesterone as needed. You'll also be given an antibiotic. Now, this is prophylactic to make sure that you don't have an infection after the egg retrieval and to make sure everything is okay for the embryo transfer. You'll take that as prescribed. In preparing for the egg retrieval, it's important not to eat or drink anything after midnight before the morning of the egg retrieval. Otherwise, we can't give you anesthesia, and that wouldn't be much fun. The egg retrieval itself can be scary if you don't know what to expect. In all honesty, it's actually not bad at all. On the day of egg retrieval, you'll need to arrive with a friend. That's really important because we're giving anesthesia, and we need to make sure that you have someone who can take you home. You'll be legally intoxicated, so you can't drive yourself home, and we can't put you in a taxi. You and your friend will arrive at the given time, and you'll show your ID to the front desk. You'll be given a medical bracelet, and you'll be escorted back to the same monitoring rooms where you had your ultrasounds. You'll meet with the physician and the anesthesiologist before the actual procedure. You'll also meet with a nurse who will give you an IV. All of the anesthesia will be administered through the IV. You'll have a chance to ask all of your questions, and then you'll be walked back to the retrieval room. Now, the retrieval room is the same room where you've had the ultrasounds, so you should be pretty comfortable with it by this point. You'll be speaking to the anesthesiologist as he administers the IV medications, and you'll be placed in something called conscious sedation, where you'll be asleep and relaxed so the physician can actually do the egg retrieval itself. The egg retrieval process is pretty cool. The physician's job is to basically aspirate the follicles transvaginally. So the same transvaginal ultrasound probe that the physician uses to measure how the follicles are growing will be used to help retrieve those eggs. On that probe, there'll be a long, thin needle. The physician will insert the probe inside the vagina and visualize both the left and the right ovaries. Once he can see how the ovaries look, he will make one tiny puncture into each side, and then he'll puncture each follicle, aspirating the fluid. The egg is in the fluid, and this aspirates into a test tube. Once he has drained each follicle from both the right and the left sides, the procedure's done. You'll be woken up and taken back to your recovery room. After the egg retrieval, you'll recover in your recovery room for about an hour. You'll also be told how many eggs retrieved. Keep in mind that we won't know how many of those oocytes were actually mature, so that number might change by the next day. We just know the number of eggs retrieved, but we can only work with the number of eggs that are actually mature. You'll be given instructions to go home and rest for the remainder of the day. The next day, you'll start a very important medication. It's known as progesterone. Progesterone can come in few forms. It can be vaginal insertion, or it can be, most commonly, intramuscular injection. Your nurse will tell you which form you're on and how to take it, but it's very important that you take your progesterone as instructed. You'll also continue your prenatal vitamin, and if you've not started a baby aspirin, you'll be instructed to do so at this time. After the egg retrieval, you'll have a few days before the embryo transfer. You'll need to take your medications as instructed, and you'll get continuous updates on the progress of your embryos. The day after egg retrieval, a nurse will call you and let you know how many of the eggs were mature and how many of those fertilized to become embryos. Now, the lab is a pretty cool place, something that you don't always see, but they are very important in this part of the process. So think of your embryos inside of an incubator, inside of a petri dish. This is where they'll be living for the next few days. The embryologist's job is to ensure that the embryos are growing the way they need to and to report to the physician that growth. We, in turn, communicate that to you so that you know what to expect. You'll get these progress reports the day after the egg retrieval, on day 3, and if everything looks okay, we might bring you in for the embryo transfer at that point, or day 5. Ideally, we want the embryos to grow to what we call a day 5 blastocyst. Growing them out to day 5 gives the physician and the embryologist information that might be important, as we want to select the best embryo that has the best chance of producing a pregnancy. You may have heard in IVF that it's common to have twins, triplets, and maybe even more babies at the same time. We prefer to do a single embryo transfer. Ideally, we want you to have one healthy baby at a time. In addition to getting your embryo news, there are some things to be aware of a few days after the egg retrieval. It's important that you listen to your body and tell us if anything feels off. One of the rare side effects is known as ovarian hyperstimulation syndrome, or OHSS for short. This is where fluid collects in the abdominal cavity and can make it a little bit uncomfortable. If you feel nauseous, have a headache, or feel like you're going to get sick, it's important that you call us. Also, if you gain some weight, it's important that you call us, as these are signs of OHSS. We can treat OHSS more effectively if we catch it early. Now the most exciting part of the IVF process is here, the embryo transfer. It's the day that you've been waiting for since you started the medications. And it truly is a day where everyone is excited, because hopefully this is the day where you'll start to become pregnant. What to expect? Well, there's a few things that you need to do to prepare. We'll tell you to come in usually mid-morning with a partially full bladder, so you'll be drinking a lot of water. We need a partially full bladder as we need to position the catheter to place the embryos just the right way. You'll come in either by yourself or with your partner, and you'll need to show your photo identification. Again, you'll be given a medical bracelet. You'll be escorted back to the recovery area where you'll speak with the physician about the status of the embryos, and together you will decide which embryo to transfer. You'll be asked to change into a gown, and you'll be escorted to the same monitoring/retrieval room you were in before. This time, however, you'll be fully conscious. You'll see on the screen the physician actually place the embryo inside the uterine cavity. It's a really exciting time. After the placement of the embryo, you'll lie down for about 15 minutes, and then you can get back up and go home while you rest for the remainder of the day. But you can go back to work after that. It's important that you continue your medications as instructed. And it's also important to keep in touch with us, as the couple of days following the embryo transfer can feel a little bit isolating. You've had so many appointments and so many conversations leading up to this point that some patients feel a letdown when they're not talking to us so frequently. Please know that we're here and happy to talk with you at any point of the process, but especially at this point when we know that you're thinking and hoping that you're becoming pregnant. This part of the process is known as the 2-week waiting period, where you're waiting to find out whether or not this really worked. The 2-week waiting period is probably the hardest part of the process for most patients. You've done everything you can up to this point, and as long as you continue your medications, you're in control. There's really nothing that you can do to increase or decrease your chances of becoming pregnant, so it's important to take care of yourself. Eat well, sleep well, and that's really important. Like I mentioned before, we are here for you, so if you have questions on how you're feeling, if you start spotting, if you feel like you're going to get sick, give us a call. Most of this is normal, but it's reassuring to hear this from your nurse or your physician. 14 days after the egg retrieval, we are going to do the blood test to determine whether or not this worked. This pregnancy test is done via serum, so it's pretty accurate. We can't do it early, and it's not advised to do it late because we're looking for specific numbers to tell us how the pregnancy or hopeful pregnancy is going. You'll come that day, and you'll tell us how you want to be contacted with the news. Some patients prefer to be emailed, some patients want to be called. Whatever makes it easier for you is something that we'll comply with. We'll call you later that day with those results, and hopefully we'll be giving some of the best news you've ever heard. If you're pregnant, you're going to continue on with your medications, and we'll do subsequent pregnancy tests, usually 3 to 4 days after. The ultrasound won't be done for another couple of weeks or so, but it's the very beginning of a very exciting journey. I can't understate the importance of having a good OB/GYN. Ideally, you'll already have one, and he or she will know that you're going through this process. But if you don't, please let us know, and we can make recommendations. We will continue your care throughout the pregnancy up until about the 7th week of pregnancy. While we wish we could monitor you throughout the whole pregnancy, it's important that you have an experienced OB/GYN who can continue your care at that point. We will do a final ultrasound and write a letter to your OB/GYN of choice that you can take to your very first appointment. We'll tell you when to stop your medications, and we'll basically give you all of our best wishes and hopes that you will keep us informed as you continue on with this part of your journey. In some instances, you may have excess embryos that we didn't transfer. We can freeze these embryos for future attempts at pregnancy, perhaps for a biological sibling. When you're ready to use your frozen embryos, you will go through something called a frozen embryo transfer cycle. This cycle is not as detailed as an IVF cycle, but does take about 6 to 8 weeks to complete. Your physician and nurse will talk to you about that at that point. Up until now, we've talked mostly about what the women have to go through in an IVF process, but the men have some homework to do as well. It's really important that the men follow the instructions given by the physician or nurse, especially for the abstinence period. For most men, they'll need to be abstinent 48 hours before they have to give their sperm specimen on the day of the egg retrieval. On the day of the egg retrieval, our goal is to extract eggs and to put those eggs together with sperm. So we'll need to get the sperm from the men that day. You'll actually be able to do this either at home, and if you want to do it at home, you can ask for a collection kit, or in our office. You'll need to bring photo identification with you. Once we receive the sample, it'll be taken to the lab where your partner's eggs are waiting. Now, the men might be wondering what they can do to help prepare for the best possible sperm sample. There's a few things that you actually can do to help. 1, let the physician know if you're taking any medications. Some medications have serious side effects for sperm motility and morphology. 2, make sure that you don't get into any hot tubs. Heat is okay, but hot tubs probably aren't a good idea at this point in the process. 3, you can drink, but please only drink in moderation. By doing these things, you'll ensure that you'll have the healthiest sperm sample possible. You may be wondering if you can exercise during the IVF cycle. Exercise is allowed, but it's important to be pretty gentle. Your ovaries are going to get heavier as we build more and more follicles, so we want to make sure that anything that bounces or twists doesn't accidentally twist the ovary. We don't recommend running, wouldn't recommend yoga or Pilates, but walking is just fine. A lot of patients have questions about the side effects of the medications. And for some patients, there's no side effects at all. But for others, they might really feel this. If you're on a drug called Lupron, it is common to feel a little bit quote-unquote hormonal. That's because Lupron puts you in a perimenopausal-like stage. So think of it as a precursor to menopause. The other medications might actually make you feel bloated, and being bloated is never a fun feeling. Just know that this bloating is temporary. Hopefully you'll be bloated for the next 9 months until you have your baby. Finally, you might be feeling a little bit lethargic. These are new medications, and your body is getting used to or assimilating to what they're doing. It's okay to feel a little bit sleepy. Cut yourself some slack and take a nap if you need it. You'll want to choose a time of day to take your medications and stick with it, roughly taking them around the same time each day. I would give yourself a window of maybe an hour or 2 either way if you need to make modifications. You can choose the time for most of your medications, with exception of the trigger shot. The trigger shot must be taken at the exact time instructed. A lot of patients wonder whether or not the injections will hurt. Well, there's 2 types of injections that you might need to take. One is called subcutaneous, and that goes into the fatty tissue, but not into the muscle. In all honesty, this doesn't hurt that much. It might be a small pinch. The other type of medication or injection that you'll take is intramuscular. These are longer needles that do go into the muscle. This can hurt a little bit, but we have tricks of the trade to help you. Progesterone injections are intramuscular, so they go into the muscle, but they can also give knots in the body, and it's these knots that cause the most pain. If somebody has knots, the tendency is to sit down and try to relax, but the opposite is true. If you have a knot, walk around. Hopefully that will help move the progesterone into the bloodstream a little quicker. An IVF cycle might be a minor disruption in your daily life. The disruption usually comes in the form of the monitoring appointments. They're pretty frequent, as we've already discussed. With that being said, our appointments start at 7 a.m. before work normally begins to help minimize these daily disruptions. We also want to communicate with you in a fashion that makes it easier. So if you prefer email, let us know. If a phone call at a very specific number is desired, just let us know. Our goal is to minimize these disruptions as much as possible. While I'm giving a general overview of how the IVF cycle should go, it's important to keep in mind that every IVF cycle is different. There's no cookie-cutter IVF cycle. Some patients might be on medications for 10 nights. Some patients might be on medications for 15 nights. Try not to compare yourself with others going through the process. Again, it's important to just take this one step at a time, keeping your ultimate goal in focus. So now we've talked about what to expect in an IVF cycle. Hopefully you have an idea of the time frame, the medications, and how things might truly go down. We're always going to be here for you, so if you have questions, let us know. In short, we're on this journey with you. We want you to become pregnant. We're here for you every step of the way, and we hope to see you at our baby party that happens every year.